Hi everyone, and welcome to video 2 out of 3 of the Introduction to LiST video series. The focus of this particular video is to learn how impact is calculated in LiST. So to get a little bit of background of the modeling structure in LiST, LiST is a linear model. It has fixed relationships between the inputs and the outputs within it. It's a mathematical model which assumes that the causal pathways of the interventions that reduce cause-specific mortality via reducing risk factors are correctly defined. It's a deterministic model, meaning that it will produce, each time you run it, it will produce the same outputs as long as you're entering the same inputs. It's population-based. It does not focus on individuals, but rather looks at population-level health. And the results are separated out in age cohorts. Impact is calculated in LiST essentially through this multiplication that we do here. So we've got our cause-specific mortality that we multiply with the intervention coverage change, that we multiply by a multiplication of the effective fraction and the effectiveness. And all of that gives us our impact, which in most cases will be the number of lives saved. So to take a look first at the cause-specific mortality, we define that as the number of births times the mortality rates times the percentage of deaths that are due to specific causes. And in LiST, we get that data separated out into data for neonates who are younger than 1 month, children who are between 1 month and 5 years old, women of reproductive age who are between 15 and 49 years old, and stillbirths. Our mortality rates information comes from the UN Interagency Group for Child Mortality Estimation, so the IGME group, and the cause of death structure comes from the WHO Maternal and Child Epidemiology Estimation. For intervention coverage change, just to take a step back and remind ourselves of what is a coverage indicator, it's the number of people who have received an intervention divided by the number of people who actually needed that intervention. And the interventions that are included in LiST have to fulfill all of these criteria. It needs to be a proximate intervention, meaning that there's either a direct link to mortality or a link that goes through a risk factor. The more distal variables that have an impact also on mortality, but that are not direct, that are not proximate, such as maternal education, such as increased GDP, we assume that those distal variables will affect the coverage, so the proximate interventions, and those will in turn affect mortality. The interventions also need to work through health programs, so whether they're community or facility-based doesn't matter, but it does need to go through a health program. The interventions also need to be feasible in low-income countries. So those are the countries in those 80 countries that have the highest maternal newborn child mortality rates. And finally, very importantly, we need to have a cause-specific evidence of effect. So we need to have data, studies, something that supports that there is a link between this intervention and a cause-specific mortality. So most of that information will come from systematic reviews, from meta-analyses, from randomized control trials, and if none of those are available, we also turn to the Delphi method. This information is updated frequently. We're constantly trying to stay on top of the most recent data available in the literature. Interventions in LiST are organized along the continuum of care. We start with the periconceptual interventions, followed by pregnancy, childbirth, breastfeeding, preventive, vaccines, and finally the curative interventions at the very end. The general framework on which LiST operates can be visualized at the listvisualizer.org. This is really an excellent tool to understand how and where the links are between different interventions and different causes of death. There's a separate video specifically focusing on how to use the LiST visualizer. But as I just mentioned, it's really an excellent tool for just understanding kind of the background of LiST and how things interact behind the software. Most of our maternal newborn child health intervention coverage data comes from the demographic and health surveys or multiple indicator cluster surveys. The DHS and MICS have produced high quality data, and they produce it fairly regularly, so theoretically it's produced every 5 years, so it allows us to stay fairly recent. The water and sanitation data comes from the WHO and UNICEF Joint Monitoring Program. Vaccine information comes from the WHO UNICEF Joint Reporting Process. And a very interesting and useful feature of LiST is all of these data sources that I've presented so far are the default data sources. So if you open LiST and create a projection using the default data, this is where these data are going to come from. But if you, as the user, already has data that is more recent or that you believe to be of a higher quality or data that you want to use for whatever reason, this is always something that you can go into the software and modify so that you can use your own data. Finally, the last step in our equation is the affected fraction times the effectiveness. So we'll start with the affected fraction. So here down in our graph, we have a visualization of 100% of diarrhea deaths. So this only looks at the number of, or the total number of diarrhea deaths. And within that, you can have different things that lead to diarrhea deaths. So in this case, we have 4 different pathogens, each with a different affected fraction. Now, 20% of these diarrhea deaths are due to pathogen A, which is rotavirus. So based on this, we say that the affected fraction of diarrhea death is 20%. So the affected fraction affected by rotavirus is 20%. To sum it up, it's the proportion of the cause-specific deaths, in this case diarrhea deaths, that can be averted by a specific intervention. So in this case, if we had an intervention that could take care, or rather save 100% of all rotavirus deaths, then we would get an intervention, we would get a reduction of 20% in this. But unfortunately, interventions typically aren't 100% effective. And in this case, the rotavirus vaccine is only 50% effective. So in the total number of diarrhea deaths due to rotavirus, so the first line that we have here with all the children in black, that represents the 20% of the total diarrhea deaths that we have. And within that, only 50% of them will, if 100% of them receive this intervention, only 50% of those deaths will be avoided for this particular intervention. So what does that mean? If we put both of those pieces of information together, we know that the affected fractions is for rotavirus is of all diarrhea death is 20%. So that's what's represented here with our 2 children in blue. That represents 20% of those 10 children who are due to rotavirus diarrhea. But because the effectiveness of our rotavirus vaccine is only 50%, of those 2 children, 50% will be saved by this intervention and 50% will not. So essentially, the conclusion is that if all 10 children with diarrhea deaths, so that's 100% of children of diarrhea death, who are dying of diarrhea death, are vaccinated with the rotavirus vaccine, only 1 life will be saved by this vaccine. The data sources for the effectiveness that we have, the effectiveness values that we have in LiST can be very varied. Usually it comes from systematic reviews, meta-analyses, the Delphi methods, and randomized control trials. In some cases, the estimates are global. In some cases, the estimates are regional. All of this data is available and easy to access within the software, so you can always refer back to the study if you have additional questions. Or if you want to take a look at kind of a compiled list of some of these studies that we pulled these numbers from, you have a list here of different supplements that have come out in different journals that kind of have this data available in them. Finally, we want to take a look at the impact of this calculation, meaning at lives saved. So the results that are available in LiST, we can get, as you can imagine, based on the tool's name, the lives saved, either the total of number of lives saved. You can get the number of lives saved by cause or by intervention or by age group. You can also look at different mortality rates. So we can look at neonatal mortality rates under 5, maternal, either the rate or the ratio, and the stillbirth rates. We can look at the number of deaths. We can, once again, separate it out either total, by cause, by intervention, by age group. And we actually have some nutrition-related outcomes as well, because that became a focus of our work in 2008. So we have some stunting, wasting, and some birth outcomes that we can look at in our results tab. We can visualize all of this information either in tables if we're just looking for numbers, and graphs if we wanted to look at trends, and pie charts to look a little bit at distributions. And to take a little bit of a look into the software itself, LiST is one module that is within housed within Spectrum. It's essentially a Spectrum is essentially a demographic projection, so it relies on one module called DemProj. And typically a demographic projection will just rely on trends in mortality and fertility and use that to project how the population will grow and what the population structure will be in the future. But in Spectrum, there's 3 additional modules that can alter this relationship. So we've got AIM, FamPlan, and LiST. AIM looks at the impact of interventions on HIV and AIDS. FamPlan will look at the impact of family planning on fertility, and that will modify the population structure as well. And finally, we have LiST, which is the focus of our work here, to model the impact of interventions on maternal and child mortality. So to dig a little bit deeper, DemProj gives us that underlying population and birth information. It gives the population size and the number of births. AIM is useful to be able to scale up HIV-specific interventions. But more importantly for LiST, it gives the number of child deaths that are actually due to LiST. So in the software, whenever a country with a high HIV AIDS mortality is in the country, or when HIV and AIDS are highly prevalent, this module will automatically be selected because so many children are dying due to AIDS. FamPlan is useful if you want to look at scaling up family planning interventions. FamPlan will change the fertility trends and therefore the birth in DEMPROG, which will in turn change the number of deaths in LiST. It'll also change the distribution of birth by risk categories. So, for example, women who are having children later or who space out their births a little bit more might have better birth outcomes than women who are having children very, very young, or women who are having children very closely, one after the other. It also changes the incidence of abortion, which in turn will change the number of maternal deaths that are due to abortion. Some general broad guidelines on how to run a LiST analysis. Essentially, the basic approach is to establish a baseline projection for either a country or a region. For that, we'll need the demography, the population structure, fertility, the contraceptive prevalence. We'll need the mortality rates, the cause of death structure, the current levels of risk factors and exposure, and the current level of coverage, the current coverage of interventions in that country or that region. As you'll see, all of these are things that we've already spoken about and how they interact within LiST. And essentially, running a LiST analysis will mean scaling up the coverage of certain interventions, the interventions that are of interest to you. And then it will recompute all of the inputs based on this new coverage data. And it'll compare to the counterfactual, meaning it'll compare to what would have happened if you hadn't done that scale up. And then the output will include all of the inputs from the baseline. So it'll do a comparison of between what happens if I increase my coverage compared to what would have happened if I had not changed any of my input. If you want more information on how the software works, there's a separate video that walks you through different aspects of the software that you could consult.